Safety and first aid. Safety means prevention from mishaps. Being cautious helps in keeping us, as well as those around us, safe from getting hurt. Safety at home. Do not keep your toys and books thrown across the household. You may trip over misplaced objects. Do not play around with sharp objects and tools like knife, blade, screwdriver, etc. Do not run around on the terrace or in the balcony. Do not lean over the railings either. Do not entertain strangers as guests into your house. Always let your parents or elders talk to them. Avoid walking on wet floor. You may slip and fall. Do not touch electrical appliances with wet hands or when you are barefoot. It may cause an electric shock. In case of any illness, refrain from taking medicines on your own. Do not throw a burning matchstick on a paper, off, or any other object. Always put off the matchstick before disposing it. In the kitchen, never play with the gas knobs as it may result in leakage of gas. Gas leakage. In case of accidental leakage from a gas cylinder, do not light fire or turn any switch on or off in the area filled with the gas fumes. It is because any sparking in the circuit can lead to a massive fire and explosion. Also, try to dissipate the inflammable gas as soon as possible by increasing ventilation. Fire. There are several reasons that can start a house fire, like short circuits, accidents while cooking, gas leakage. Careless handling of inflammable items like kerosene and firecrackers can also be dangerous. Accidental fires can be prevented by following certain safety measures. Keep matches and lighters out of reach of children. Do not plug in too many electronic devices in one power socket. Do not wear synthetic clothes when around flame or firecrackers. Keep inflammable items like kerosene away from gas cylinders in kitchen and fireplace. Turn off electrical appliances when not in use. Avoid overheating of electronic devices due to prolonged use. Do not use any damaged power cord or socket to run an appliance. It may cause short circuit. Install a fire alarm and fire extinguisher in your home. Also learn how to use a fire extinguisher. Do not let waste papers and old useless clothes pile up inside your home. They increase the risk of spreading an accidental fire. In case fire breaks out, following steps can be useful in saving lives. Safety on roads. Roads are the places where most accidents occur. At any time, there are a lot of people walking or driving on a road. We should remember certain safety measures to save ourselves and others from accidents on road. Never run around or play on busy roads and streets. Always wear a helmet while riding a bike. Always wear a seat belt while riding in a car. Use a footpath when walking on the road. When on foot, cross the road at zebra crossing or when the traffic light is red. In case neither is present, look to your left, then to your right, and again to your left before crossing the road. Follow the traffic light signals for your own safety. Avoid going out in bad weather conditions. Drive slowly when the roads are wet due to rains. Safety in playgrounds. Do not hit or push others while in the playground. Do not jump off from swings or slides. Do not engage in conversation with strangers nor accept anything to eat. Do not play games that could be dangerous for you and others. First aid. We should always be careful to protect ourselves from accidents or injuries. But in case someone around us gets hurt due to any reason, we should be able to provide them with immediate basic medical help. First aid, as the name suggests, is the foremost help given to a victim of sudden injury or illness. It is usually given by someone present in the immediate surroundings of the victim while the expert medical help arrives. It is important for everybody to have knowledge of basic first aid because it helps to save lives. It gives comfort to the victim and prevents the situation from getting worse. It encourages safe lives. Following are some types of emergency health situations in which first aid can be useful. Cuts and wounds. In case of a cut or wound, the primary concern should be to stop the bleeding and preventing infection of the affected area. Before tending to the injury, wash your hands properly with soap and water. Apply pressure on the cut with gentle but firm hands. Use a folded piece of clean cloth or gauze and maintain the pressure for a few minutes. In case of heavy bleeding, lay down the victim and raise the affected part of the body level. Use a tight cloth band called tourniquet above the point of injury to constrict the blood vessels and stop the bleeding. After the bleeding has stopped, clean the wound using cotton and antiseptic lotion. Apply sterile bandage and dress the wound properly. In case the cut is deep or given by a rusted piece of iron, the victim needs to be given an anti-tetanus injection. Burn. In case of a minor burn, keep the affected area under cool, running water for at least 15 to 20 minutes. This will prevent further burning of the tissues. Apply aloe vera or a burn ointment to soothe the pain. After this, cover the burnt area with sterile and non-sticky gauze or loose bandage. Avoid scratching if blisters form. It can cause infection. In case of a major burn, call for medical help immediately. If a person catches fire, wrap him up in a blanket and make him drop and roll to help extinguish the flames. Apply loose and moist dressing. It should be non-sticky to prevent from further damage to the skin. Do not leave the victim alone until expert help arrives. Fracture. Fracture occurs when a bone breaks. It can be identified by the bruising and inflammation at the site of injury, abnormally twisted limb, or severe pain in movement of the area. In case a bone is protruding, do not attempt to push it back in place or even move the affected part. If there is bleeding at the site of injury, stop it by applying gentle, constant pressure. Dress the wound and carefully support the broken bone with a splint or a sling. It will help in immobilization of the nearby joints. Use ice packs to reduce swelling and pain. Seek medical attention for further care of the broken bone. Sprain. Sprain occurs when the ligaments at a joint get damaged or torn. It can be identified by inflammation and pain at the point of injury. Rest the sprained part and use ice pack to reduce swelling. Apply ointment to lessen the pain. You can also give medicine to the victim upon doctor's advice. Nosebleed. Nosebleeds occur due to rupture in the blood capillaries lining the nasal passage. Make the victim sit up straight and bend their neck slightly forward. Gently pinch the nose from the lower end and wait for 5 to 10 minutes. Ask the victim to breathe through the mouth. This is done to allow a blood clot to form and stop the nose from bleeding. In case the bleeding does not stop, seek immediate medical help. Bee sting and insect bite. Remove the sting by brushing it off with your finger. Immobilize the area and use ice pack to reduce the swelling. Apply antiseptic cream and anti-allergic injection if he starts showing symptoms of allergy after being stung. Animal bite. In case of a bite, wash the wound properly with soap and water. Apply antiseptic cream and bandage the wound. Change the bandage regularly to prevent infection. In case the victim is bitten by an animal which is not vaccinated against rabies, seek the help of a doctor immediately.